Today we are here at Baptist Medical Center and we are celebrating the inaugural cohort of our nursing students who were a part of the preceptor training program. So today we want to speak to Chair Warren about how this program came about, what was the idea behind it.
It was about bringing nurses to Jacksonville from Florida A&M University. What else could it be about? We do such a great job of training nurses at Florida A&M. It was my desire to see more of them here in Jacksonville, and particularly at this hospital, at Baptist Hospital. I serve on the Baptist Hospital Foundation Board and am engaged in their social responsibility committee. But the foundation here has underway a capital campaign to raise quite a bit of money for a variety of purposes, and I thought what better purpose than to have a internship or a learning experience here at Baptist, one of the largest, if not the largest, regional hospitals in the area for nursing students from Florida A&M University. And we're just now ending the training of the first cohort here, and by all accounts they have had a wonderful experience by their own admission and by that of the hospital.
And what is it that in creating and working together to bring different organizations together to create this program, what is the goal of, for the outcome of the students? I know you mentioned that they did such a great job, but what is it going forward that you hope students will get out of it each semester that they participate in?
Well, let me answer that question by leading you with this.
Okay.
What I want is a continuing experience for Florida A&M nurses here at Baptist. So to do that, we had to have a continuous source of funds to do that. So we, in partnership with Florida A&M Foundation, the Baptist Health Foundation, and the Eartha M.M. White Legacy Fund, which is a fund that I chair. Between the three of us, we have amassed roughly $100,000 in an endowment fund to be able to pay for a continuous flow of nursing students from Florida A&M to come here and to have a practical experience here in the hospital. So the desire ultimately is, as for any educational institution worth its salt, is to provide training and the development of young people, and the back end of that is that training then allows them to move into work. And that's what we do here at Baptist Hospital, is we hire people to service people, to care for people. And so my great desire, as it was, I found when I talked to Baptist, is theirs as well, is to have access to nurses being produced by one of the best nursing programs in the country at Florida A&M University, and have them have their practicum experience and ultimately maybe even to be employed here as well. That's the great goal, is to walk into the hospital one day and all of us be proud of the fact that there's a large number of Florida A&M nurses working here.
Great. And I know one of the strategic areas of emphasis that has been listed by our Board of Governors is healthcare careers. What role do you feel like the board as well as the administration can play in ensuring that FAMU answers that call, that need for minority nurses, the need for, as you mentioned earlier, the gap that is expected in nursing, where there's going to be a need in the state for quite a bit of nurses?
Right. Well, it's no great secret to most who follow our national economy, and more particularly that of Florida, where lots of people come to retire, that we have great need for healthcare technicians, to include nurses and doctors. So here in Jacksonville in particular, a large regional area with one of the favorite retirement communities of naval personnel and Marines who have experienced Jacksonville. But this community has a great need for nurses, as does our state and our nation. We project that there will be a significant shortage of nurses by the year 2025. I think the projected shortfall is about 50,000 nurses. That's a lot of people and a lot of hospitals in need of the kind of talent that we're training at Florida A&M University. And in this area, Baptist Hospital is, if not the largest, one of the largest regional hospitals in the state of Florida. So an experience here is a great one. Baptist is in partnership with an internationally renowned organization like MD Anderson, who specializes in cancer research and cancer treatment. It is affiliated in a variety of ways with hospitals to its south into Georgia, and to its north into Georgia, and to its south into St. Johns County. I mean, it reaches wide in terms of its services to people. So the exposure that a nursing student at Florida A&M University could get here could hardly be matched in many other places.
Last question. What do you envision as chair of the Board of Trustees, working with the students and administration, the role that FAMU can play in possibly duplicating such programs, having more hands-on experience for the students, so that they can go out into the community, get the experience, bring it back, or like you said, find themselves right here in the community and develop from there?
Well, I think all of us who tout ourselves, if you will, as being leaders on the campus at Florida A&M University, from foundation board members to the president of the university and her staff to board members, we owe our students our attention. We owe them an excellent education, and we owe them particularly our attention to their aspirations after they leave Florida A&M. This program is about that, being able to provide inroads for them to satisfy their vocational aspirations once they leave Florida A&M. So if we're going to spend our energy on stuff, if you will, that stuff should include what happens to a Florida A&M graduate after leaving, and whatever we can do to facilitate them finding a place to exercise their talents, we should be doing that. But that includes us being able to put in place the financial resources for them to be able to get the training they will need, so when they arrive on the scene, they are the smartest young nurses, or the smartest young business people, the smartest young environmental engineers that anybody could find anywhere to employ. We owe that to them. And so this small thing that we've done here at Baptist Hospital is the kind of thing that we can grow. It can be extrapolated on and duplicated, replicated in other areas of the university. So we find these kind of experiences for Florida A&M University grads. I speak about it selfishly because I'm a trustee there. I'm currently the chair of the Board of Trustees and feel obligated, to be honest with you, to do all I can in the community where I am in particular to provide place for the Florida A&M flag to wave high in the community where I reside. And the young ladies who have experienced their practicum here at Baptist Hospital have created enough wind for that flag to flap back and forth very strongly. And I'm trusting that the next cohort that comes behind them will have a great experience as they have, and they will be representative of the university in the great way that these 4 young ladies who've been here have been.
Great. Thank you so much.
You're quite welcome.